Hello and good afternoon, everyone. Welcome to today's Career Discovery live stream presentation on healthcare careers as an aide. My name is Amanda Wydula. I'm the University and Student Development Coordinator at the Bank of North Dakota, and I will be facilitating today's webinar. During today's session, attendees will learn about the education, duties, pay, and career outlook for careers as a healthcare aide. Just some housekeeping items. In the menu of the webinar, there's a Q&A function, and we will encourage all of you to use that box for your questions about today's webinar. We will answer the questions at the end of the webinar, but please put them in the Q&A when you have them so you don't forget. Today, we have two panelists. The first is Brian Williams, who is the CEO of the Sakakawea Medical Center and Cole County Community Health Center in Hazen, North Dakota. Brian oversees the operations of a critical access hospital and 4 rural clinics. Brian brings more than 20 years of industry experience, including 11 in leadership. Our next panelist is Melanie Super. Melanie is the Executive Director at Prairie Point Assisted Living in Bismarck, North Dakota. Melanie has worked in the long-term care industry for just over 7 years. Over her career, she has held the roles of Executive Director and Regional Director of Operations, but is most proud of her time spent as a CNA, CMA while in college. Melanie knows the importance of a dedicated certified nursing assistant and what a true impact one can have on the lives of those they care for. So welcome to both of you. So attendees, if you have been to one of our career discovery webinars before, we haven't done this before. So I am actually going to launch a poll. So you can go ahead and I'm going to launch the question here. So the question is, what motivated you to register for this webinar today? So I want to learn more about careers in healthcare. I'm watching as part of a class and other. All right, so it looks like everyone it looks like 67% of our attendees just wanted to learn more about careers in healthcare, and the other ones, and let's see, 33% said other. So if you answered other, go ahead and pop the reason into the chat feature that the reason why you're here today. So, all right, so we will go ahead and get started with our first question. So, Melanie and Brian, can you give a brief description of the tasks that aides do in each, or in all of the different areas that maybe you've worked in yourself, or even in the institutions or facilities that you currently work in or have worked in?
Sure. Did you want to go ahead first, Melanie?
Sure. So we have dietary aides and CNA, CMA, so certified nursing assistants and certified medication assistants in our community here at Prairie Point. Our dietary aides do things, their daily tasks are taking orders for the residents. Our dining is restaurant style, so they'll tailor each meal individually to the resident. So they'll take the orders, deliver meals, clean the dining room when the residents are through with dining service, help with washing dishes, and then they assist our chefs with culinary tasks as well. So maybe it's helping bake desserts or chopping or helping prepare salads, things like that. And then our certified nursing assistants, they help our residents with activities of daily living. So bathing, dressing, assisting them with light household chores that they need done in their apartment. And then we have certified medication aides, and those are typically CNAs that started their career as a CNA and then advanced their education through the medication certification course and are now able to administer medications to the residents as well. So most of our CNAs here are both med certified as well as having their CNA.
I'd agree. Those are most of the functions that you see an aide perform. I'd also like to say that really aides are really the backbone to most healthcare facilities. That's, in my opinion, where the rubber meets the road. I like here at in Mercer County, we have Knife River Care Center, and the aides are probably the ones in whom the residents see the most. They're the ones who the residents come to identify with as taking care of them. They're also the ones that seem to have the best relationship with the staff because with the residents because they're most around them. In a hospital setting, our aides do a multitude of things, but I would say probably the most is they do a lot of the hands-on things, such as helping patients with baths, helping them with other tasks that are more physical, that don't require a more uh, a greater license like a nurse. And in our clinics, they do a lot of the rooming of patients. They do a lot of working with the providers to ensure that patients are the workflow is going well and the patients' needs are being taken care of. I would say though, in all reality though, the aides, whether you're in dietary, whether you're um, in clinical or wherever, that's really where the rubber meets the road. That's where people really get the experience of what it's like to that introductory to healthcare, whether it be on the dietary side or clinical side. That's really where people come to understand the importance of caring for others. It's a great stepping stone for others. Others never want to leave that position because they love that hands-on experience that they just get in that position that's not always offered in other positions.
Wonderful. That that's a really good description. And actually, oh, hold on, let me go back. Um, our next question is, what are the different kinds of aides positions available? Which, by answering the previous question, I mean, you outlined a lot of different options for people. Were there any that you didn't mention, or others that maybe your facilities are maybe needing right now or are always needing in your facilities?
There's in the hospital setting, there's other kind of aides. We don't necessarily call them aides. We call them things like scrub techs and those kind of things. But you find that that skill set is needed throughout a healthcare organization. And those scrub techs, what they do is they go into the surgery area, and what they're there is they're like a CNA almost in that surgical area. They're there to help where needed, to run errands, to move things back and forth. You have that with physical therapy. An aide will come out and maybe they're doing basic things. A PTA, physical therapy assistant, that does take a little bit of education and stuff. So I think you find aides throughout the whole organization and in the healthcare setting. I think the hard part is figuring out what your passion is. I think that's a hard part about being an aide because there's so many options. It's not like once you're a nurse, you're kind of stuck being a nurse. Being an aide, you can really jump around in the healthcare facility to really find what meets you and your passion and your desires.
Wonderful. Yeah, I think, a lot of students, may or may not know how to get started in healthcare. And these positions sound like they're great positions to kind of be that launching point for, whether they stay in these careers for, the endurance of their lives, or maybe they move on to something else. So Melanie, was there anything else that you wanted to add to that?
No, on the assisted living basic care, being we're just a two discipline facility, that the only position that would be in addition to that would maybe be a housekeeping or laundry aide.
Good to know. All right, so we're going to move on to our second polling question. So I'm going to launch that right now. So as a reminder, attendees, when the poll launches, if you want to answer. So the question now is, when considering a job or career, what kinds of things are important to you? So of course, I can only put 5 in there, but I hear from a lot of students when we're out at college fairs or in general, thinking about things that are important to them. So they want to help people. They want a job that's personally fulfilling. The pay and benefits. Where is that job located, or where can you move for that career? And then, of course, other. So, and you can pick more than one. This is a multi response if you choose. So far, 67% chose personally fulfilling as one thing that they look for when they're considering a career or a job in the future, and 33% said that they wanted to help people. So I'm going to go ahead and close that poll. Thank you so much for participating. All right, and then moving on to the next question. So what kind of education or training do these workers need?
Go ahead, Melanie.
So for our dietary aides, there are no certifications or minimum experience required. Typically, many of our dietary aides are high school students. You alluded earlier to the fact of getting your foot in the door, Brian, and kind of feeling out the waters, and that's a great place for people to start, is in that dietary position. Many of our dietary aides have transitioned into being a CNA, and then also a CMA. So it's a great way to start. CNA does require a certified nursing assistance license. And those are offered through several different entities across North Dakota. And then CMA certification, many facilities, I know ours is one of them, offer that right on site. So if someone comes in and as a CNA, we're able to help them through that certified medication aid program right here on site to help develop and grow their career for them. And as far as education, there is no minimum educational requirement for CNA, CMA, or dietary aid.
Yeah, in the hospital setting and in the clinic setting, a lot of this goes back to what kind of organization you're working for and a lot of their specific guidelines for their employees. I know at Sakakawea Medical Center, our CNAs, they come in and all of our, even myself who has no medical background whatsoever, I'm a business guy, we require all of our people to take annual training, and those annual trainings are things such as slips and trips and how to use a ladder, basic electrical things like don't plug in your hair dryer if you're in the bathtub, those kind of things. But then we also have some specific things like CPR. We also have some skill training checklists that we go through annually. And the reason for those is it allows you to understand where you are, what you're doing, and what else you need to make sure you're keeping up with because you are doing hands-on patient care for CNAs. We also have opportunities for individuals to do more than that as they desire to through that system. On the clinic setting, it's very much the same thing. We require all of our CNAs to have basic CPR. We also have them go through annual certifications like blood pressure checks. They learn how to check in patients, and they get into our EMR, and they can actually assist our patients with simple process of checking in and preparing for the provider. So there's a lot of opportunities, but I would say probably the greatest skill you need to have is your ability to interact with people. If you don't have that ability to interact with people or that desire to interact with them, I don't think there's any opportunity for you in that position to be successful, nor other positions within the hands-on clinical side for you to be successful. If you don't like dealing with people, that's why we have finance people. They're they're great. They do an awesome job, but they love to be by themselves. And there are opportunities for ground level positions there. But with that CNA aspect and that hands-on, you really, really need to want to work with people, be attentive to their needs, and you want to do everything you can to help them enjoy what's going on, even though it's a really tough process for them.
Awesome. So Melanie, you kind of alluded alluded to it earlier, and Brian, you kind of mentioned it right there as well. So growth opportunities within. So, whether it be like a promotion or maybe you're able to access, a certification to, maybe do something a little bit different. What are some of the opportunities that you have in each of your facilities for this?
Sure. Uh, well, I mean, myself, I've been an example of how you can move up, and the opportunities that are available in healthcare. I have my business degree and was selling long-term care insurance and decided that nursing was my passion and helping people was my passion. Went back to school, received my CNA and worked as a CNA while going to nursing school. Later became a director of an assisted living facility, was there for 8 years, then became a regional director of operations for an assisted living company, and did that for 6 years, and now have been realized that my passion really was being in the building with the residents, with the staff, and so I've been in this current position again, now going on 3 years. So, being a CNA in itself is extremely vital, but it's also a stepping stone for those that want to further their career, that want to further their education. And, I've always said that a nurse should always have to be a CNA and a doctor should always have to be a nurse. Starting at an entry-level position and working your way up really does give you compassion and empathy and understanding for all of those that you're entrusted to lead. So we have many CNAs over the years who have become nurses, some that have become nurse practitioners. Dietary, I've seen dietary aides that go back to school and get their culinary degree and become a chef. So there's just a world of opportunities in healthcare in several different departments for advancement.
Awesome,
I
Brian.
think, I think Melanie's right. She's a perfect example of you'd never know what's going to change your life. I know in our organization at Sakakawea Medical Center, we actually have CNAs that come in, and we have a program there that helps them earn their LPN or RN through our program. We work with another institution. It's a college, so that they could do their practicals and most of their studies there. But also, if you look at it, like she said, I know individuals that have become hospice CNAs, where they go in and they're working with individuals who they're on hospice, and because of the love of the people, they have that desire to become an RN or an LPN, and they're able to move up and they make huge changes. I really think the opportunity of growth as an aide, it really depends on the person and really what their desire is. I know individuals who have actually, I have other CEO friends in the country that one of them actually started out as a dietary aide, and he's now a CEO of a hospital. So you never know what this is going to do, or what kind of skills you're going to learn that's going to benefit you, whether you go into marketing, whether you go into finance, whether you stay in that clinical role. These skills are vital for your future.
Awesome. Thank you so much. And I think one thing that's really important, especially, for any high school students who are listening right now, like entry level work, and those jobs that you can get right away when you're in high school or in college with, minimal education, it's so important to take those jobs and do the best that you can because like, Brian said, you develop skills that you're just going to be able to build on for the rest of your life, and you don't know the ways that they'll impact you in your further education. So our next question is, what is the average workday like for an aide or a CNA, CMA? Um, what kind of hours can they expect, time, all of that kind of stuff?
I don't know. Is there an average workday in healthcare, Brian?
I've never seen one.
I haven't seen one. I think it truly varies, especially on the setting. Here in our facility at Prairie Point, we're a small assisted living basic care. We only have 51 apartments. So our CNAs really get involved in all areas of operation here. So they may be helping with activities. They may pop into the dining room and help out the dietary servers, uh, help with some housekeeping if the housekeeper, is taking a PTO day. They just really jump in wherever is needed. Typically, our shifts are 8-hour shifts. We do offer smaller or shorter shifts for college students, that 4 to 9 evening shift. So that's their typical schedule anyway. And working anywhere from, we have some aides that just work, 1 day a week, to aides that are full-time at 40 hours a week. So really it's a wide variety of shift availability, of time availability. That's the nice thing about healthcare, is we're open 24 hours a day. So there's always a good time schedule to meet needs of college students or older individuals just looking to work part-time. There's a lot of opportunity.
I agree. I know in the hospital setting, most of our aides work 12 hours, but we do have some that work less. I think really the average day, it varies. I mean, you come into healthcare thinking, hey, it's really easy. You're going to do A, B, C, but there's so much that happens. We have aides that work on the med surg floor, and they also rotate through the ER. So they may not have anything really to do for an hour or two except take care of some patients and do some of those basic duties. And then all of a sudden we have a trauma and it's all hands on deck. And so they see some of the most um, trying circumstances for some of our patients. And then in the clinic setting, they get the opportunity to be there. Usually it's Monday through Friday, 8 to 5, and they do it a little differently. They have the opportunity to be in a nice office, and it's just the same pace for the most part. But they still get a lot of curveballs thrown at them. They still have to be on their toes. People call in sick. Things happen. We do call the ambulance because somebody comes in and they say, "Oh, my chest hurts," and then you run EKG on them and you're finding out they're having a heart attack or something to that effect. And so you're calling the ambulance. There is no normal day in healthcare. But one thing I will say is if you like to stay on your toes and if you like the ability to flex and do a lot of different things and have different opportunities, healthcare is a wonderful place for you.
Awesome. That is a wonderful guidance for students. So moving on to our third poll question. Attendees, I'm going to launch our final poll question. And just looking at our attendees, it looks like we have a lot of school counselors on today. So while this question may not be relevant to you, I'm going to tweak it just a little bit verbally. So what type of facility would you be most interested in? Or what type of facility do you see that the students that you work with are most interested in working in? Of course, your students who are interested in working in healthcare. All right, so far we have 100% of our attendees saying that their students are most interested in working in the hospital setting. So yeah, hospital setting is what most of our attendees students, what they hear from them. So I'm going to go ahead and close that. All right, so I think what everyone wants to know, what are the pay and benefits like? I'm sure it's a wide range just because there's so many different types of positions available in each of your facilities.
So I can start. It depends. A nurse aide starts at about 13.75 an hour, but a certified CNA starts at about 14.25 an hour. And that doesn't matter if you're 28 or if you're still in high school. And that's at the hospital side. But there's a lot of benefits that go into working for a healthcare facility. There's Most of us offer vision, dental, and health. Most of us offer 401ks, which I know in your teens and early 20s, you're like, that'll never happen. I'm never going to get old enough to retire. But now that I'm older, believe me, it does happen. So there's a lot of opportunities there. Um, but I think there's a lot of benefits that we don't talk about that people don't really look as it's not a salary or a physical benefit. But really, what you find, I think the greatest benefit working in the healthcare industry, and Melanie probably knows this better than I do, is those people that you work with become family. The benefit of having this relationship, being able to see it, to see somebody on a regular basis in the care center facility. My own kids worked in the housekeeping department in a care center, and as they worked there, those elderly people became like grandparents to them. They would see them daily. They would work with them. And those people would teach them things. It's amazing that I think the biggest benefit is when a nurse sees a CNA that really wants to be part of something, they really take them under their wings because they want them to be successful. And the benefits normally, it's not pay and it's not, hey, I've got health insurance. It's really that friendship and that added mentorship and that opportunity to grow personally, I think is some of the greatest benefits I see in healthcare.
Yeah, Brian, you're absolutely correct there. The by far the greatest reward is that relationship that you build with those residents. Uh, I took a break for 1 year, didn't even make it a year, went into finance, and I needed to get back to what my heart yearns for, which is the residents and being with them. They really are family. That said, a person still has to eat. So dietary, our diet, we do go based on years of service. Our dietary starts at $13.15 and goes up to $15.95 per hour. And our CNAs start at $15.95 and go up to $17.65. And our CMAs start at $17.10 and can go up over $21 an hour, depending on experience.
Wonderful. Yeah, those are some great opportunities for a lot of people. All right, so our final question, and you both have been doling out the entire time, but is there a piece of advice or guidance that you would give to someone pursuing an aide position or an assistant position in the healthcare industry?
You first, Melanie.
Go ahead. Okay. I guess my advice would be to keep an open mind. When I for my CNA license, I swore I would never work in a nursing home. I was one of those 100% on your poll that thought, no, I'm going to go to the hospital and I'm going to work in OB and that's going to be my life and that's what I'm going to do. During the CNA course, I did it's been so long now, I forget what it's called, not a practicum, but you had to do in a nursing home. And I was hooked. Less than 8 hours, I was hooked and just never looked back. So I think, when we're younger, we have this vision of what our life is going to look like and what we want to do. And sometimes we just go down a completely different path. So be open to that and try new things, and you might just discover that your passion is somewhere that you didn't know it lied or laid. I wasn't an English major either.
I'd have to agree with Melanie. She kind of summed it up pretty well. The only thing I would have to add is, I would give it your all. I know this sounds really dumb, but there is no glamour in changing a bed. There is no glamour in behind the scenes. But really, that's where you find what you're made out of. As you do the hard tasks, you really find out if this is a passion for you. I don't know any doctor who says, I really found out I wanted to be a doctor because of all the easy stuff. They always say it was the hard stuff that really helped them understand that this is what they wanted. This was the passion. And I would say be open minded and just give it your all. You're there to learn skills, there to learn opportunities, and never shut your mind down. I'm there with Melanie, one of my very good friends who's a DON at a care center. He left a surgery suite as a DON of a surgery suite, not DON, but a nursing supervisor in a surgery suite. And he took this job just to see what it was like. And he's been in it for 7 or 8 years now. And he's like, I would never go back. And it's all because he opened his mind and he gave it all. He loves the residents. He calls them his family of 100 is what he calls them. So I would honestly say if you're going to go into healthcare and if you're going to try it, learn to love the hard stuff just as much as you love the easy stuff, and realize that hard stuff is going to make you a better person than the easy stuff, but it's also going to help you find your passion.
That is wonderful advice. Thank you two so much. You can really see your passion for healthcare shine through with your answers. So thank you so much. For the attendees out there, if you have any questions, go ahead and pop them in the question box below. But that was our last question for today. So I'll give you a few minutes to ask questions if you have them. Our next career discovery webinar is Thursday, March 11th. So this Thursday at 1 p.m. Central Standard Time on healthcare careers as an assistant or tech. So similar to today's session, attendees will learn about the education, duties, pay, and career outlook for careers in healthcare as an assistant tech and as an assistant and tech roles. So we'll be talking about a couple different opportunities that students can have, in college. So, and then next week, we will have 2 more presentations on student services, specifically on the TRIO program and vocational rehab services. So as always, you can register for these and all career discovery webinars on the Career Discovery tab on the Career Compass website. All right, we didn't see any questions come in because you two answered the questions and the discussion so thoroughly. So I thank you both and all of the attendees for coming on today, and we will see you at our next webinar. Bye.
Thank you.
Thanks.